So on 1 October, hospitals here in the Valley received hundreds of patients.
As the tragedy unfolded that night, healthcare workers had no choice but to put their heads down and work to save as many lives as possible.
And ahead of the 4-year anniversary of the attack, 2 nurses at Sunrise Hospital recall what that night was like.
Once our first patients started coming in, it didn't stop. Our most critical patients were the first ones, and surprisingly, they were not brought in by ambulance. They were brought in by private cars.
There was a lot of tears from patients, a lot of patients in pain. The staff communicating together to get patients in and out accordingly so that we could treat more patients.
I think I still find it hard to believe that somebody could do such an act. That one person can cause so much heartache.
Emotional as a nurse to see that because, it wasn't a sickness, it wasn't a disease. Somebody did this to these people, and that was an emotional thing that, I had to deal with.
We had just like a normal amount of staffing on, and then every time I looked up from taking care of a patient, there was another doctor that had come in. There was another nurse that had come in. A lot of them in plain clothes because they were at barbecues or family events.
That night is just a night that I think any of us that were on shift will never forget.
I try to think of all those positive notes to get me through, because if not, I'm going to start remembering the faces of people that I took care of and maybe couldn't save. So I have to look to those positive things and how well we all did that night with the circumstances that we were given.